Okay, hello Facebook. Desiree here from our marketing communications team, and I of course have our own Chief of Staff, Dr. Carroll, next to me. And then over here we have Glory, who is our Revenue Cycle Manager.
And helps us with...
Is she in the shop? Okay. she's over our scheduling and appointments.
Patient access. She's very important.
Yeah. Which we know a lot of those questions are about. Okay.
So I'm going to take my mask off for a minute so I can talk to you better. I'm going to ask these guys to back up so that we're safe. So hello from Shriners Hospital, Salt Lake City. Again, I'm Kristen Carroll. I wanted to start by first saying how much we really miss you guys. We really miss seeing our patients. We miss interacting with our families. We miss doing the work that we've been trained to do. And we all realize how important it is with social distancing and keeping our staff safe, and more importantly, our patients and their families safe. But we really, really miss you. And we're looking forward to a time when hopefully we can start seeing you more again. Perhaps even above and beyond virtually, which would be great. Although that option does exist for now. We are open for business. I operated this morning because certainly there are some kids who have problems that are simply too urgent to be put off. And that's really how we're trying to think about things, is which kids really, really need the care right now that is worth the risk before that risk starts to decrease a little bit, making it safe for more people to get our care. But we are open for business. We are open for clinic visits. They are being assessed, again, on level of urgency and complexity. But if there is a time that we could see a kid even virtually using our Skype platform, we're happy to do that as well. And that's both for new patients as well as follow-up patients.
Okay, great. So I'm going to give Dr. Carroll some of the pre-submitted questions that people have been sending us through social media leading up to today's live. And also feel free to leave a comment below. We've got Dora working the camera back there, and she's watching for your comments, so she'll let us know any questions that come through. So overwhelmingly, the most popular question we have is just about what appointments are we taking. And Dr. Carroll kind of addressed that. Is there anything else you want to say about that?
Yeah, so this is in flux right now, and honestly, every week it's different. I'm sure many of you have heard that elective surgeries are now going to be allowed in May, and we're all really looking forward to that too. But that doesn't mean that everyone is going to get care in May. Where we have to start is probably with more simple procedures that we know we can do as outpatients. In other words, going home the same day that you have a surgical intervention, rather than the more complex cases where kids have to stay in the hospital longer. Because the longer you stay in the hospital, the higher the risk until we know that that surge is on its way down. So for right now, elective surgeries are going to get planned in May. We are working on a plan to come up with making that as safe as possible for everybody. We're talking about testing. Do we have to test everybody? Do we only test certain kids? And we're in consultation with Primary Children's Hospital and the University of Utah, as well as the Utah Hospital Administration, trying to come up with a plan that fits all of us. With regards to clinic, we are going to open up clinics a little bit more to more kids now that it seems like it's safer to do so. The rules are the same though. Please, just one child, one adult. We can't bring siblings, we can't bring more adults. Again, the more people around, the bigger the risk. Everybody will be masked and washing hands and wearing gloves and all that sort of thing. But we do want to see more kids in person. The virtual visits are going to stay. They'll probably be here forever. We found that they're actually incredibly useful for some things, so kids don't have to drive quite so far. So we will continue to keep them available as well.
Great. You've answered a lot of other questions in the answer. So let's talk a little bit about what people can expect when they walk through our doors.
Sure. That's a good question.
That screening process.
That's a good question. So you will get called before your clinic visit and before your OR if you are one of the ones that is healthy enough with an elective surgery that's outpatient that we can hopefully schedule sooner. You'll get called about exposure for you or your family to somebody with known COVID infection, and that's very important. Please be truthful about that. any sort of symptoms of COVID, which again have expanded now. Arthralgias, meaning pain and aches, a really unusual headache, loss of sense or smell, obviously cough, shortness of breath. But those other things are a little bit newer, and we're using those as a screening tool as well. When you get to our door, you will get screened again. There will be somebody taking your temperature with a touchless thermometer, as well as, again, asking you to wash your hands. They'll go through the questions one more time, and then give you a mask if you don't have one. We luckily have like unbelievably fabulous sewing ladies who have been making us these great cloth masks, and they've made them in both pediatric and adult size. So we'll be able to give some of those to your family if you don't already have one.
Great. So once they get into their appointment and they're interacting with their staff, what kind of protective gear they're wearing, and what's the reasoning behind that?
So we are going to be using masks on everyone, again, to protect against droplet transmission. As much as we can, staying apart. Obviously, children have to be touched and examined, and if that's the case, then we'll put on gloves. When we do that, we also will be wearing eye protection as well if we get within 6 feet. For the babies, getting clubfoot casts, that sort of thing, babies have a tendency, there's not as much real estate, so you have to get really close to the face and the nose. So those practitioners who are taking care of club feet will actually be wearing a face shield, a longer thing than just glasses. But that's the reason.
Great. Gloria, I know that when I talked to you earlier, you were saying that the one parent was a real concern. People wanted to bring more than one adult with them. Anything else you want to say about that and why it's such an emphasis?
I think Dr. Carroll explained everything pretty well right now. So the emphasis right now is trying to avoid the major amount of people in the building as possible. We understand that there's some parents that need to bring more than one child at a time. Those cases are being evaluated individually.
Okay.
So if we call a parent the day before and they say, because we have the case that they don't have daycare for the other kids, then we just transfer the call to the care manager that is available, the nurse that is available, or even the same doctors, and we triage case by case.
Right.
That's a great example of how we are looking at each case, what's best for that family, right?
We are evaluating them individually day by day.
And the same is true of those clinic visits that have already been canceled or bumped because of COVID, as well as surgeries. Every single surgeon who works here, plastics, ortho, all of us, are meeting with our care coordinators, our nurses who help us, and going through each and every one of you, person by person, and trying to figure out where is the best place to put them that is the safest for that child on a level of priority because of what's going on with their particular situation. So do know we have run through your names multiple times and will continue to do so until we get this sorted out and we get everyone taken care of in a safe way.
Great. One question that came up is, are we taking non-emergent fracture care at the hospital?
So non-emergent fracture is kind of a strange term. Fractures in general are emergent. What we're taking are fractures that don't necessarily have to go to the operating room. So there are fractures that just need to be stabilized, put on a cast, that sort of thing, evaluated, and we're happy to see those right now. Obviously, some come in that are a surprise and have to go to the OR. That's what happened this morning. And if that's the case, we'll take care of you. But in general, we're trying to minimize our work through the OR at this point while we're sorting out our exact protocol, which again, hopefully will be in place within 2 weeks.
Awesome. And you addressed this at the beginning, but just in case we've got some new viewers jumped on, this was a big question. When will we be taking elective surgeries again?
Right. So elective surgeries again, we are shooting for hopefully the week of May 11th to redo our elective surgery schedule. I know some people are saying, but it's open May 1. That's true, but it actually takes some work to get everything organized, make sure that people are pre-authorized for their care. Many people, unfortunately, have lost their jobs and their insurance has changed. So we have to go through the pre-authorization and the surgeries that have already been canceled and make sure that that's still appropriate. And again, we're working on who do we test, how do we test them, and when and how. so that it's as safe as possible for everyone.
Great. So you've kind of mentioned a few times our virtual visits. So let's talk a little bit more about that. And in particular, one person had a concern of, I really prefer that one-on-one in person with my doctor. From a provider's perspective, what do you see the benefit of using those virtual visits?
Right. I definitely had the same concerns, but I have to say, it's very sort of an intimate visit, because I feel like I'm in someone's home with them. And I get to see their dogs running around and their cats, and I had one girl, I had to ask her to put her ferret down so I could watch her walk. It is still one-on-one. It's just you and the provider in the room. So it's very private. There's no issues with HIPAA or somebody overhearing. We close the door. It's as if you're right there, but you're in your house. The issue I have with it, of course, is that I can't actually lay hands on the child. So sometimes I have to talk the parents through how to do the exam I want to see. The other issue is x-rays. And some people are getting x-rays before and then emailing them to me so I can look at them while I'm visiting with them virtually over Skype. But I have to say, it's actually a medium that I have enjoyed more than I expected myself.
Awesome. And we released a video a few weeks ago saying that we were not accepting new patients with virtual visits, but that has changed,
That's
right?
changed, yes. So we're able to see kids virtual visit new patients now. I saw 2 this week. We also are looking at, hopefully within the week, being able to expand that to physical therapy visits and maybe even our brace shop visits, which would be wonderful for families so they don't have to come all the way here.
Great. And we have that video on our YouTube channel. If you want to see that more explanative video, talks about what technology is required. Dora's giving me the eyebrows. Do we have some questions coming in?
Yes, we have a question. Do appointments stay as scheduled for international patients?
That's a really good question. International patients have been particularly difficult. Now with the borders closing, it's really hard. But what we're doing for our international patients is usually quarantining them for 2 weeks before seeing them if they absolutely have to be seen, or if possible, moving their visits down the road a little bit till we know it's safer, June or July. But we have seen definitely some international kids, but they've had to be quarantined for 2 weeks before, very rigidly, before we have them come into clinic.
Thank you.
Great. Is that all the questions we got at the moment?
I believe so.
Okay, awesome. Okay, one final question. What is in store for our recovery phase?
Yes, good question. So that keeps me awake at night for sure. But in our ramp-up discussions, what we have been discussing is right now at the Shrine here in Salt Lake City, we operate Monday through Thursday. What we're talking about is in the summer months, possibly also opening Friday and doing a Friday OR. Maybe adding some evening clinics or even Saturday clinics. One thing that is certainly in the patient and family favor is that people really, really want to work. We are tired of not working, and people are ready to work really hard, and that may be expanding our hours and sort of changing some of the formats that we've had by extending them into times where we normally wouldn't be doing clinical medicine. But hopefully we're going to be able to add that. Our nurses in the OR are ready to ramp up and do those Fridays if necessary, as well as people in clinic have voiced that they would be interested in working on Saturdays if that's required.
Great. So we want to make sure that all of our patient families know and all of our supporters know that we are committed to communicating things as they change, as they're updated. Our website has a brief there that's called What to Expect at Shriners Hospitals for Children in Salt Lake City, and we update that several times a week. So we are doing our best to get word out. If you have more questions that we missed, if you're watching this after it's live, feel free to leave those questions in the comments, and I'll consult Dr. Carroll and Glory and get those answers to you as soon as we can. And we just appreciate you watching. Oh, we got another eyebrow from Dora.
I don't want to interrupt. Gloria, could you clarify a little bit? It was hard to hear. We had a little comment, so if you could just recap a little bit.
Can you repeat the question one more time that you had for me before?
It was the question she answered before. Okay, so it was about families that had a concern about only bringing one parent.
Okay, so what I mentioned before, it was Dr. Carroll was very specific with that. But the reason why we're having only one parent with one child is to avoid the risk of get other people contracting other type of viruses, in this case the coronavirus or any type of illness that is going around. We do understand that some parents need to bring their kids in. So in the night before, when we called the patients to triage and made the basic questions that we have regarding the coronavirus, we asked if only one adult can come in with that patient. If not, if they have to bring more kids, then we transfer that phone call to the nurse that is available or any care manager that is available, and they can make the decision of what to do with that patient and that patient.
So basically, in summary, it's one patient, one kid is the optimum, but we know that families don't always work like that. Sometimes there's just no one else to leave your children with. So if that is the case with you, and please make sure that there is really no other option, because every single human that comes in worsens the risk for everybody. But if there is no other option, please let us know, and we will discuss that with our infection control nurse or me, and we'll try to come up with a solution for you.
Okay, great. Any other shout outs?
And say there's lots of people showing hearts and love for Dr. Carroll's. They love you and saying thank you for everything that you do for us.
Yeah, she's great. We love her.
We love her too.
She's a great spokesperson for our hospital. Thanks for watching. Stay safe.
We really, really miss you.
We
Hopefully
miss
see you
Stay
soon.
safe.
Hopefully to see you soon.